A company starts with its vision, and the vision of this organization is to preserve limbs.
Over 90% of all amputations can be prevented if there's early intervention and if they go through minimally invasive procedures that we do.
The patient population that truly benefit from our care are those that suffer from diabetes. So what we're looking at is where can we best benefit the patient population.
When you go to the hospital, you are a cog and wheel. They have such a huge degree of services. That's kind of the point of an outpatient facility in the first place. The outpatient facility has a lot less staff, it's a lot smaller, it's a lot more personal to the patient, and it provides you much more immediate care. So we have the ability at our facilities to get you in stat. So if a doctor calls in and tells us this patient has a potential toe amputation or foot amputation, can you see if you can do anything? We get them in same day.
We see our patients long term, almost like primary care physicians. It doesn't just stop with the initial visit or after we've had the procedure. We continue to see them long term, and I value those relationships.
We have the ability through our technologies and through our procedures to do things that were unthinkable even a few years ago. That we now have micro-invasive techniques that can get into those small arteries in the foot and actually open up those vessels.
We're at 17 facilities at this point in time and growing, and our goal is to expand and even partner up with rural hospitals because there's really a lack of care at a lot of these hospitals and patients are getting amputations there. Geographical area expansion is important because there are many people lacking this type of care.
You know, when I first started at Modern Vascular, there were 4 compelling reasons why I wanted to be here. First is their mission and vision to save limbs. That's really a cool thing. I'm passionate about that personally. The second is we have really outstanding physicians that are doing these procedures. Third is we have a great procedure that we can do with low risk that can now treat things we couldn't treat before. And then fourth, we have great results.
One of the great joys of doing what we do is seeing our patients walk into the clinic. Not in a wheelchair, but walking into the clinic. They say that they're now an active member of their family again.
We have so many testimonials, and when you see some of these testimonials, not just the Google 5-star reviews that are all over the place, but when you communicate to the patients and the doctor communicates to the patients and our nurses communicate to the patients, and the patients are so thankful that their amputation has been prevented or their pain has dissipated and they're able to walk much further or exercise at this point in time that they couldn't before. It is a pleasure to see because their quality of life has improved.
You can see the joy in their faces. You can hear the stories of, I can actually feel my feet. I can actually feel the carpet on the bottoms of my feet now. We see it all the time. And that's the greatest thing about this business and this job is you get to see your results quickly.